The SARS-CoV-2 virus, the culprit behind the COVID-19 pandemic, continues its relentless evolution. Like any living organism, it adapts and changes over time, leading to the emergence of new variants. This constant mutation is a natural process, but it requires our constant attention and vigilance. And now, a new variant designated NB.1.8.1 has recently emerged onto the global stage. This variant, like others before it, possesses unique characteristics that scientists are working diligently to understand. Initially detected in China, NB.1.8.1 quickly caught the attention of health authorities. The initial identification in China served as an early warning, prompting further investigation and monitoring. NB.1.8.1 is now appearing in other regions across the globe, signaling a potential for wider dissemination. The spread to different regions underscores the interconnectedness of our world and the ease with which viruses can travel across borders. This increasing prevalence is raising global attention and prompting discussions among international health organizations. The World Health Organization and other agencies are closely monitoring the situation, assessing the risks, and coordinating responses. Understanding the characteristics of new variants is absolutely crucial for informing effective public health strategies. It allows us to anticipate potential challenges and tailor our responses accordingly. This understanding is the bedrock for adapting public health strategies, ensuring they remain effective in mitigating the impact of the virus. These strategies encompass everything from vaccination campaigns to mask mandates and social distancing guidelines. NB.1.8.1 is notable because of specific mutations it carries. These mutations are the key to understanding its behavior and potential impact. These mutations could lead to potential changes in transmissibility, meaning how easily it spreads, and immune evasion, which is its ability to bypass the protection offered by vaccines or previous infections. Scientists around the world are diligently analyzing its genetic makeup, scrutinizing every detail of its code. Early reports suggest mutations that warrant close observation and further investigation to determine their precise effects. These initial findings are crucial for guiding future research efforts. The global scientific community is actively sharing data and research findings related to NB.1.8.1. This collaborative effort is essential to ensure a swift and coordinated response to the emerging threat. Its origin in China, a major international travel hub, raises concerns about the potential for rapid international spread. This highlights the importance of robust international border health screening and surveillance measures. Public health agencies around the world are increasing surveillance efforts and genomic sequencing capacity. This allows them to effectively track the spread of NB.1.8.1 and other emerging variants, providing crucial data for informed decision-making. While the situation is still developing and much remains unknown, vigilance and continued adherence to established public health guidance remain our best tools for protecting ourselves and our communities. The emergence of NB.1.8.1 serves as a stark reminder of the ongoing threat posed by the SARS-CoV-2 virus. It underscores the critical need for sustained scientific investigation, global collaboration, and continued public cooperation to effectively combat this evolving pandemic. NB.1.8.1, first identified in China, emerged as a variant of interest, prompting global health authorities to closely monitor its spread and characteristics. Its initial detection in China served as the starting point for understanding its potential impact on the global landscape, has quickly spread to other regions. This rapid dissemination highlights the interconnectedness of our world and the ease with which viruses can traverse international borders. The variant's journey across continents underscores the importance of robust surveillance systems and coordinated global responses. Hong Kong and Thailand were among the first outside China to report cases, indicating early signs of international transmission. These initial reports served as a warning, prompting increased vigilance and testing efforts in other countries. The swift detection in these regions demonstrated the effectiveness of local surveillance systems, reflecting strong travel links. The high volume of travelers between these regions and China facilitated the rapid spread of the variant. This highlights the critical role of travel patterns in the dissemination of infectious diseases across the globe. The variant has also reached the United States, raising concerns about potential community spread within the country. Health officials are closely monitoring the situation and implementing measures to contain the variant's spread. and parts of Europe, indicating a wider global distribution. The presence of the variant in multiple European countries necessitates coordinated efforts to track its transmission and implement appropriate public health interventions, mainly through international travel. The ease and frequency of air travel have played a significant role in the variant's ability to reach distant corners of the world. This underscores the need for enhanced screening and monitoring at international airports. Numbers remain low in many places, offering a glimmer of hope that the variant's spread can be contained. However, vigilance is crucial to prevent potential outbreaks and ensure that the situation remains under control. But health authorities are monitoring for signs of community transmission. This proactive approach is essential for detecting and responding to any potential surges in cases. Early detection allows for timely implementation of control measures to mitigate the impact of the variant. In China, some districts have seen a rise in COVID-19 positivity rates, suggesting a potential resurgence of the virus in certain areas. This increase in positivity rates warrants further investigation to determine the extent of the outbreak and implement appropriate control measures, coinciding with the variant's appearance. The correlation between the rise in positivity rates and the emergence of the variant suggests a potential link between the two. Further research is needed to confirm this association and understand the variant's role in the increased transmission. Hong Kong reports a growing proportion of new cases, indicating an increasing prevalence of the variant within the region. This trend raises concerns about the potential for further spread and the need for enhanced control measures. Linked to NB.1.8.1. This confirmation underscores the importance of genomic sequencing in tracking the spread of emerging variants. By identifying the specific variant responsible for the increasing cases, health authorities can tailor their response strategies accordingly. Genomic sequencing is being ramped up to better understand the characteristics and behavior of the variant. Increased sequencing efforts will provide valuable insights into the variant's transmissibility, severity, and potential impact on vaccine effectiveness. Though reported cases likely undercount the true spread, many infections may go undetected due to asymptomatic cases or limited testing capacity. This highlights the importance of relying on multiple data sources and modeling techniques to estimate the true extent of the variant's spread. Tracking the variant globally helps inform public health responses and containment strategies. By monitoring the variant's spread and characteristics, health authorities can make informed decisions about implementing targeted interventions, such as mask mandates, social distancing measures, and vaccination campaigns. The rapid movement of NB.1.8.1 underscores the challenge of controlling respiratory viruses in a connected world. The ease with which viruses can spread across borders highlights the need for global cooperation and coordinated efforts to prevent future pandemics. Ongoing surveillance is essential to adapt strategies as more is learned about this variant. Continuous monitoring and research are crucial for understanding the variant's behavior and developing effective countermeasures. This adaptive approach will enable us to stay ahead of the virus and protect public health. In the ever-evolving landscape of viral variants, experts across the globe are maintaining a vigilant watch. One particular variant, identified as NB.1.8.1, has garnered significant attention from the scientific community. This heightened scrutiny is primarily due to its potential for increased transmissibility, raising concerns about its ability to spread more rapidly than its predecessors. Adding to these concerns is the possibility of immune evasion, meaning it might be able to bypass some of the protection offered by previous infections or vaccinations. Early genetic analysis suggests, based on initial findings and computational models, it may spread more easily and efficiently than previous variants, potentially leading to a faster rate of infection within communities. Mutations in its spike protein, the part of the virus that binds to human cells, could reduce the effectiveness of immunity derived from vaccines, potentially making individuals more susceptible to infection. The same mutations could also diminish the protection gained from prior infections, increasing the risk of reinfection. Though it's important to note that vaccines still provide a significant level of protection against severe disease, hospitalization, and death. A more transmissible variant, even with reduced severity in individual cases, can lead to higher overall case numbers and subsequently strain healthcare systems, potentially overwhelming hospitals and medical facilities. This is true even if individual cases are not inherently more severe. as the sheer volume of infections can still create a significant burden. Vulnerable groups, such as the elderly, individuals with underlying health conditions, or those with compromised immune systems, remain at a disproportionately higher risk of experiencing severe outcomes from infection. Scientists are diligently studying how well current treatments, including antiviral medications and other therapeutic interventions and diagnostic tests, work against this particular variant to ensure effective management of infections. Ongoing research and comprehensive surveillance efforts are crucial for driving proactive and informed public health measures, designed to mitigate the spread and impact of the variant. Enhanced monitoring systems and flexible intervention strategies are key to staying ahead of potential surges and minimizing the impact on public health. Symptoms of NB.1.8.1 largely mirror those of recent Omicron subvariants. Common symptoms include sore throat, persistent cough, nasal congestion, fatigue, headaches, and muscle aches. Fever may occur but is not always present or may be mild. Gastrointestinal symptoms like nausea or diarrhea are less common. Loss of taste or smell is now rare with this variant. Symptom severity varies by individual, influenced by age, vaccination status, and health conditions. Testing remains important, as symptoms can resemble a cold or flu. Early detection and consultation with healthcare providers help manage illness and prevent spread. The rise of NB.1.8.1 has reignited discussions about face masks. Experts recommend targeted mask use in high-risk indoor or crowded settings rather than broad mandates. High-quality masks like N95s or KN95s offer strong protection. Masks reduce both the spread from infected individuals and exposure for wearers. Consistent, correct mask use is most effective, especially when many people participate. Masks are particularly important as NB.1.8.1 can spread from asymptomatic individuals. Public health officials weigh mask recommendations against pandemic fatigue and local risk. Masking remains a valuable, low-cost tool for reducing transmission if the situation escalates. In Hong Kong, authorities are monitoring NB.1.8.1 and emphasizing personal hygiene. Regular hand washing and use of hand sanitizer remain key defenses. Mask use is encouraged in healthcare settings, care homes, and for those with respiratory symptoms. Good ventilation in indoor spaces is strongly advised to reduce airborne transmission. Individuals are urged to consider ventilation when choosing where to spend time. Vaccination, including boosters, is still recommended to protect against severe disease. Staying informed through official channels and seeking prompt medical care for severe symptoms is essential. These combined measures help protect vulnerable populations and limit spread. In the U.S., the CDC is tracking NB.1.8.1 through genomic surveillance. Experts recommend a layered approach: vaccination, masks, ventilation, and hand hygiene. Staying current with COVID-19 vaccinations, including boosters, is strongly advised. Vaccines remain effective at preventing severe illness, even with new variants. Mask use in crowded indoor settings is encouraged, especially for high-risk individuals. The CDC's Community Levels Guide helps inform local mask decisions. Improving indoor ventilation and frequent hand washing are also emphasized. Testing when symptomatic and staying home if sick help prevent further spread. Protecting yourself from NB.1.8.1 involves simple, effective steps. Practice regular hand hygiene with soap and water or alcohol-based sanitizer. Stay home if you feel unwell and get tested if you have COVID-19 symptoms. Keep up to date with recommended vaccinations and boosters. Use masks in crowded indoor spaces, especially if community transmission is high. Ensure good ventilation by opening windows or using air filtration. These combined measures create a strong defense against respiratory viruses. Taking these steps helps keep you and your community safer. As new variants like NB.1.8.1 emerge, informed vigilance is key. We now have effective tools, vaccines, treatments, and knowledge to manage COVID-19. Stay updated through credible sources like the WHO, CDC, or local health authorities. Avoid misinformation and focus on evidence-based guidance. Be flexible and ready to adapt behaviors as recommendations evolve. Sensible precautions and public health support allow us to move forward without panic. Focus